Okay, this is part 2 of week 10, and so we're moving on to the automatic pressure injector. And so that, of course, is the device that injects the contrast, and it can deliver a more consistent, a more precise injection versus hand injections. So the main parameter of the automatic pressure injector is the flow rate, and that is how much contrast per second. All automatic injectors have 4 basic parts. The control panel, this is the touch screen that you use to set the parameters. Of course, the syringe where the contrast is loaded into. There sometimes is a heating device. This heats up the contrast to decrease the viscosity. So viscosity refers to the thickness and stickiness of the contrast, and so to decrease the thickness and stickiness, or to decrease the viscosity, you can warm it. And then there's the high pressure mechanism, and so this is the part that pushes the plunger of the syringe. Injections can be given at both low pressure, which means not a lot of force, and high pressure, which means lots of force. It is important to know that all catheters have a maximum pressure rating. This means that catheters should not be used above a certain PSI, pounds per square inch. The automatic pressure injectors have safety features. There's a pressure limiting device. This is preset on the injector so that the pressure never exceeds a certain amount. If it did, the catheter could burst and could cause an embolism. Acceleration regulator. This allows the injection to be accelerated gradually to avoid catheter whip. Think of a limp garden hose, and then when you turn the water on, quickly the end of the hose whips around, and that could happen with a catheter as well and could cause damage. Okay, moving on to percutaneous equipment. So you need to know what the word percutaneous refers to, and that means to do a procedure through a small puncture in the skin. That would be versus the cut down method, which would require a large incision, whereas percutaneous is just a small puncture. Angiographic catheters and guide wires. Of course, there are diagnostic and interventional ones. I do want to add to this that the guide wires, the core of a guide wire, whether it be diagnostic or interventional, the core of a guide wire is called the mandrel, M-A-N-D-R-I-L. So just be sure to add that to your notes. The core of a guide wire is the mandrel. And then there will be another wire wrapped around the mandrel like a spring, and that is what gives the guide wire its torque. Okay, so still talking about catheters and guide wires. The interventional guide wires are longer. Interventional catheters have a larger lumen. Now, the French size is the same. So if you have a 6 French diagnostic and a 6 French guide catheter, they're going to be the same French size, so meaning their outer diameter is the same. But the interventional catheters have a larger inner diameter or lumen. So this is so that you can still inject contrast while there's a balloon catheter inside it. Interventional catheters are stiffer. This is to provide support for all the different devices that must try and pass through the lesion. Okay, moving on to intravascular diagnostic devices. And there are 2 of these that we deal with. The first one is IVUS, and the second one is FFR. And so we are talking about IVUS here now. So IVUS, again, is intravascular ultrasound. So this is an ultrasound probe on the end of the catheter. And here's what an IVUS picture looks like. So again, remember I said in an earlier lecture that IVUS is able to look at the blood vessel wall, not just the lumen. And so here it's showing you the intima, the media, the adventitia. So it is able to see the blood vessel wall, which is important. Here is showing you an abnormal blood vessel. And then also, too, IVUS is helpful in deploying stents. So here we can see if the stent is adhered correctly to that intima of the blood vessel, and if it's not, then it can be reinflated. The catheter is inside the blood vessel. It gives a cross-sectional view of the entire blood vessel, not just the lumen. Why is this important? Well, sometimes an angiogram can be misleading. Sometimes a lesion is worse than what it looks like on an angiogram, or it can be not as bad. So IVUS can tell us for sure how big the lesion is. It can also tell us how big the lumen is. It can also tell us if the lesion has calcium in it. And finally, it can help when trying to decide what size stent to use.